Thank you, Mr. President. Ladies and gentlemen of the Senate, would I be in order for a point, Mr. President?
You are in order.
Just briefly, there was an editorial in Des Moines Register this morning regarding HIP Iowa. This is the federal program that was established to provide high-risk pool applicants opportunity for health insurance under the federal program that was established by the Obama administration, of which Iowa received a $35 million appropriation. Since the inception of the program, there are only 212 registered Iowans that are taking advantage of the high-risk pool, primarily because of what's called third-party pay limitations that require the state to not allow for third-party payments for agencies that have the ability to pay for coverage for low-income or disabled Iowans. Currently, there are more than 100 Iowans that fit this classification that are not covered under the high-risk pool that are HIV positive and are receiving high-risk medication for life-saving drugs under the ADAP program, which is a federal program. If they converted those payments into health insurance payments, they would be covered under the high-risk pool and then would have insurance for their essential medical needs for the next, well, through 2014, when they would be covered under the national program. So since the inception of the program, the administrative costs for this HIP Iowa program have far exceeded the value of the medical claims for the 217 people. In fact, they've spent over $1 million in administrative expenses for these 217 people, and they've only spent, well, the first year they only spent $400,000 on medical claims. The second year, we're now up to $4 million, leaving a balance of over $30 million of unused money that will go back to the feds if we don't cover these people. Other states have been very successful enrolling thousands of people in their high-risk pool, and so it's essential that we do something with this program this year. We passed that provision out of the Senate and sent it to the House, and that was stripped out of the omnibus bill. That is now back in our laps and up for consideration. I urge this body to act upon this, which is what the point of the editorial was this morning. I urge you to get familiar with this issue. There's Iowans whose lives depend upon this. Thank you.